welcome to the first full day of the family gathering. I think there may be some people, I think there may be a couple new people here with us today. So I'm Michelle Davis. I'm Executive Director of the IFOPA. And I'm going to just run through a quick few housekeeping things as we get started this morning. So I hope you have your cell phone with you. Because one of the things we want you to do, I finally got it right. This is the hashtag. And I couldn't remember what the hashtag was, so I went to Suzanne Hollywood's page because she's been tweeting and putting it on Facebook and Instagram for the last 2 days, even before the meeting started. So if you are on any of those social media accounts, use the hashtag today so that we can search and see everybody what they're posting, and we can repost it too. So hashtag FOPFamily18 is what you should use today. Do, if you can, turn your phones to silent so we don't have that interruption, but keep them on so you can be tweeting and active on social media today. So we talked yesterday about Connect, Learn, Grow, and one of the things I wanted to share with you, I wanted to connect about a very special program at the IFOPA, the Jeannie Pieper Awards. So as you look at your name tags, there are lots of different color ribbons on the name tag. Some are for our wonderful sponsors, some are for speakers, the red ones tell you who's helping work the event, who's volunteering for the event. But there's also, and there's one for Team Cure FOP, our fundraising coordinators, but there's also a very special one, and that's a green ribbon, and that's for our Jeannie Pieper Award winners. So this was a program that was started, I believe, 2010, I think, was the first year that it was started. And each year in the spring, we take nominations from the community of people that should be honored for the work that they've done. And this year was a very special year. There's an award category called the Presidential Lifetime Achievement Award. And Jeannie, as the president emeritus of the organization, always picks that award winner. And this year, she talked about it, and she called me, and then she called the other members of the committee, and then we all had a conversation together. And what she did this year was she said, anyone living with FOP, anywhere in the world, should be a Presidential Lifetime Achievement winner this year because they are such fighters. And so if you are a person living with FOP, you should have a green badge. Some of you have asked me, now why do I have this badge? What does it mean? It means that Jeannie loves you and that she admires you and that she's grateful that you're out there with a cheerful heart moving forward every day. So that's what the green badge means. There's also other winners. There's a Community Involvement Award, both an individual and a group for fundraisers. There is an award for international leadership, which is really cool. And then there's an Inspiring Leadership for a younger person who is very active in the community. So now that you've heard my spiel about the Jeannie Pieper Awards, I hope that next spring, when we send out the nominations, that you will be inspired to make a nomination for those awards. They're very special, and it's a fun opportunity for the community to go through the nominations and learn more about other people. I just want to remind you that there are several things that you can be doing to get involved today and tomorrow. On the 4th floor is where you'll be going to your Ask a Doctor and Ask a Dentist meetings tomorrow. The IFOPA Biobank. So I don't know if they're all here in the room. If you're in the room and you're working on the biobank, so here's Margot Black. Margot, stand up. Also, we have Yushashi Dadwal. She may not be here yet. And then Dan Perrin. Is Dan in the room? He may be upstairs. Okay, so those are the folks that are working on the IFOPA Biobank. And again, that's blood, urine, or saliva. All of them, one of them, your choice. And those appointments will be available tomorrow. You can sign up at the registration desk. We also have the UCSF. Oh, go ahead, Ed.
Consider the biobank for the future.
Okay,
so
if you're in the trial, you cannot participate in the biobank. Great distinction. But if you have friends or family with you, we need those samples, so we hope that people with you will donate. So Kelly Wentworth and Vivian Liu, where are you guys? Are you in the room? There you are. So Kelly, stand up. So they are with UCSF, and they are here collecting for the microbiome study. And that is part of the study they're doing on gut health. And so there used to be a parameter that if you were siblings, you had to be of a certain age, living in the same household. That no longer exists. So we will take any sibling pair, any age. You could be living in different cities, doesn't matter. So, and we're not collecting anything here, but you're going to have an appointment and talk with them and learn more about what's required and take the materials home with you. And if you're a parent that's here without your kids, you can still stop by and get the information about how your kids can participate at home. So we hope you'll stop by the 4th floor. Yeah. Okay, perfect. So anyone living with FOP, even if you don't have siblings, you can still participate. And there are appointments available today and tomorrow for the UCSF study. So sign up at the registration desk. And then the last thing I'll mention is as you're walking to the elevator, on the 4th floor, Resource Connect, we're going to have a big presentation on it this afternoon, but you definitely want to stop by there and see the tools that you've shared with us and that we've collected, that Amanda Callie has done an incredible job of collecting to help you live more independently. So on the 2nd floor today, we're doing the Share Your Story interviews. More of you have been stopping and signing up. I think Monica Tiffany, are you in the room, Monica? There she is. So Monica's over here. She's one of the people doing the interviews. So if you see Monica, she's kind of got like a light green jacket on, a sage green jacket. Just stop her. We can create a time today for you to meet with her and share your story, or you can sign up for an appointment time tomorrow. You can also still shop at the store. Lots of people have been getting their gear. That's great. We've got Ed, our fabulous photographer here. He can take pictures of you, a professional photo. He can take a picture of your feet. We'd love to have you peel off your shoes and socks and take a picture of your toes so that we can use it for our awareness campaign. And he's in the magenta room, which is right past the registration desk. And then the last thing is the resource table. So as you're walking to and from the elevator, we've been collecting lots of things that could be helpful to you. Some things about disability and Medicaid and Medicare. Some things about all kinds of different programs that might be of interest to you. So just stop by that table. Anything on it is free for you to take. I also just want to take this quick opportunity to again say thank you to our sponsors who make this event possible. This year, BioCryst is a supporter of the event. They're a new pharmaceutical company new to working in FOP. And then our collaborating sponsor, Blueprint, who, as most of you know, I hope you know that we'll be starting a trial after the beginning of 2019. But I just wanted to take a second, and I wanted to have Donna Grogan from Clementia, and then we'll have Amanda Seif-Sharney from Regeneron just share with you just for a brief moment. So come on up, Donna.
Thanks. It's a real honor to be here and to support this wonderful initiative and this community in general. It's about 5 years ago, almost to the day, that I was introduced to this amazing community at the 25th anniversary of the IFOPA down in Florida. I was a brand new chief medical officer at this brand new company with this brand new disease that I had never heard of before. And I had the honor to be able to meet 60 of you. Many of you are still in this room. And at that point, we were actually working collaboratively with you and the investigators to usher this community from the era of research and caring for the patients to a clinical trial era. When we introduced our natural history study at that meeting, we partnered with all of you to develop a disease-specific physical function questionnaire that is now used in our clinical trials. It's used in the FOP Connection Registry, and we initiated our phase 2 clinical program. I mean, just an amazing time 5 years ago. And now we fast forward. I mean, it feels like this to me. For a patient living with FOP, I know it feels like it's a lifetime, but amazing activities have happened in the past 5 years. Who would have thought 5 years ago that we would have not only palovarotene in clinical trials, but another investigation in clinical trials, and 2 more agents coming, and other research activities ongoing? I mean, it's just truly amazing progress that has been made and built on the shoulders of all the years of research of everyone that came before us. And so it's also a really honor and a privilege for me to be able to now help this community transition to the next phase. Research is important, clinical trials are important, but the holy grail is getting a drug approved. And we recently announced that the FDA has agreed that our phase 2 flare-up outcome data is sufficient to file a new drug application. So now we're transitioning into the regulatory process. Still a lot of work to do, and filing is not approval, but fingers crossed, and we have confidence in our data, and we really hope that we'll be successful for all of you. And so as we grow as a community, we're also growing as Clementia. And I just want to recognize a couple individuals who came with me representing Clementia, because I'd like you to be able to interact with them and talk with them during this conference. So Dr. Rose Marino, stand up, Rose. So Rose is a pediatric endocrinologist who joined Clementia 2 months ago, and she's taking over as the FOP medical director, all the day-to-day activities for the clinical trials that are ongoing. Dr. Maurizio Eddy, where's Maurizio? Oh. So Maurizio, again, joined Clementia in September as well. He's the Vice President of Medical Affairs for the Americas, and he'll ensure the relationships are ongoing with all of you, and also to help explain the potential and the role of palovarotene as a treatment for FOP. Saray Largay. Saray is the general manager in the United States and also is responsible for distribution of the drug worldwide. And she's really responsible for ensuring that every patient who could benefit from palovarotene has access to palovarotene. We've made that commitment, and that's very important to us. And last but not least, Armel Rishardi. Armel, stand up. So Armel is heading up our early access program and also critically responsible for the relationships with national organizations in Europe and also with our commercial activities in Europe. So I encourage you to speak to all of them during this meeting, pick their brains, tell them what you need. And again, thank you so much for letting us sponsor this event and be part of it.
Thank you so much, Shauna. And congratulations. Yeah, it's amazing. Okay, and Amanda Seyf-Charney is also here with Regeneron Pharmaceuticals, also one of our visionary sponsors.
Thanks. So good morning, everybody. My name is Amanda Seyf-Charney, and I am here with my colleagues from Regeneron. I am joined with Dr. Scott Mellis from Clinical Development, Dr. Eduardo Forleo, who is responsible for the clinical program, Melissa Simos-Lemos, who is supporting all of our clinical trial work, and is Ron here somewhere? And another one of our colleagues, Ron Reigman. So I want to echo what Donna said, that this is really an amazing time for the community, and we're really proud to be one of several organizations that are really working to bring treatments to the community. It's been a real honor for us to support this community and to be able to participate and be at these events so that we can really learn everything that we need to from you, so that as we bring medicines forward, they're really relevant and meet the needs of the community. So we've had the pleasure of participating in a few of these programs, and I noticed when the hands went up, there are several people who've been to several of these. There are some folks who haven't been to a lot of these. I know that we have learned from being here. We've participated in the Connect, Learn, and Grow and have appreciated the opportunity to do that with you. So I know that you guys are going to have a great day and a half, and thank you, and proud to support the community. Thank you, Michelle.
Thank you, Amanda. It's so interesting when I tell people what I do and where I work. I'm like, boy, I bet, with such a small population, it's hard to have people so interested in studying that disease. I'm like, that is not our problem. We are so blessed to have many amazing companies that are working on FOP. And there's a kind of a chart that explains that in your handout, in your attendee packet. So I hope you'll check that out. Okay. So again, don't forget to use the hashtag. And I am excited. So you will see on your table a beautiful book. I have to call it a book because this year it's 68 pages. So a beautiful book that every year our dedicated researchers at the University of Pennsylvania Dr. Kaplan, Dr. Shore. Where's Dr. Shore? I know she's in here. There she is, Dr. Shore and Dr. Al-Muqaddam, Dr. Mona, here in the front, that they worked diligently to put this book together for you. And this is it was released electronically on Tuesday, and some of you have been telling me that you've been reading it online, but we also wanted you to have copies of it as well. It's always fun to not just read it, but to look at the incredible pictures that have been collected over the last year. So I hope that you'll take, there should be enough for at least one copy per family. I hope you'll take it with you. I'm excited to share with you this morning that Dr. Kaplan is going to come and he's going to kick off the learning this morning. And he's always got an incredible quote, an incredible story, and so we're excited to hear from him.